Now, in this last part, we're going to be talking about the disorders of the acid-base balance. So these disorders could either lead to acidosis or alkalosis. And both of those could either be due to respiratory causes or metabolic causes. So we are going to be basically talking about 4 different disorders. And we already know that the normal pH of the internal environment of the body is 7.35 to 7.45. That's our range. If the pH falls below 7.35, that means that the body is going through a phase of acidosis, which could either be due to the accumulation of acids or due to the loss of bases from the body. While in the case of alkalosis, the pH is going above 7.45, which could happen due to the loss of acids or due to the accumulation of bases. So we'll take a look first at the different causes of acidosis. Well, you want to look at the source of acid. So if the acid was due to the accumulation of carbon dioxide, which led to the formation of carbonic acid, that is known as respiratory acidosis. And the cause would have to be something going on in the lungs. So for example, increase in carbon dioxide levels means that there is less washing away of carbon dioxide. There's accumulation of carbon dioxide, which could be due to decreased rate and depth of breathing. So hypoventilation, maybe the person OD'd on drugs that led to the inhibition of the respiratory centers. Or could it be due to the obstruction of the airways, due to maybe intake of, eating something and it just went down the wrong way. There could be decrease of gas exchange, for instance, in pneumonic patients or patients of pneumonia, where, again, it's harder to get rid of carbon dioxide, leading to the accumulation of all of that carbon dioxide that changes into carbonic acid, hence the patient has respiratory acidosis. On the other hand, if the acid that is accumulating is anything besides carbon dioxide, so we call those non-respiratory acids, that would be a case of metabolic acidosis. And we can accumulate non-respiratory acids, for example, in kidney failure, where the kidney fails to excrete hydrogen ions. So those hydrogen ions are going to accumulate in the body. Or, for instance, in uncontrolled diabetic patients where there is excessive production of the ketone bodies that were acidic. Another reason for metabolic acidosis, besides accumulation of acid, could be, on the other hand, that the acids are normal, but we have lost way too much of bases. For instance, during prolonged diarrhea. Remember, from the digestive system, we said that the intestine produces lots of alkalinic secretions to neutralize all of the acidic gastric secretions. So during prolonged diarrhea, there is loss of all of these alkalinic intestinal secretions, which can lead to metabolic acidosis. Also, on the other hand, if patient has prolonged vomiting with loss of intestinal secretions. So the very first steps of vomiting would be vomiting the gastric secretions full of all of that acid. And that could lead to a state of alkalosis, not acidosis. But if the patient keeps on vomiting beyond the gastric secretion, now that patient is vomiting intestinal secretions, which means, again, they could lead to this case of metabolic acidosis. So you have to figure out if the patient is in a case of vomiting or prolonged vomiting, because these could lead to 2 very different conditions. And here I found this image, I thought it was very interesting to kind of use, and it shows the different causes of acidosis. If, again, the source of acid is carbon dioxide, that is respiratory acidosis, meaning for whatever reason we are hypoventilating. Is it due to a drug overdose? Could it be due to pulmonary edema? Is it due to an obstruction of the airways? Or maybe the patient has a neuromuscular disease or a chest trauma where the patient is unable to breathe. So again, all of these, anything that can cause hypoventilation will eventually lead to respiratory acidosis. Now for the causes of metabolic acidosis, again, we are accumulating acids that are non-respiratory acids. So for example, ketone bodies developed in uncontrolled diabetic patients, or maybe the patient has OD'd on salicylic acids, which is aspirin. Okay, so aspirin is made out of an acid known as salicylic acid, and ODing on that can definitely lead to metabolic acidosis. Or we said that it could be due to renal failure. So the kidneys are now unable to excrete hydrogen ions, or maybe it's due to severe diarrhea or prolonged vomiting. Now, on the other side of the spectrum, where the pH is above normal, the patient will be going through alkalosis. If that alkalosis is due to the excess loss of carbon dioxide, that is known as respiratory alkalosis, and it would definitely be due to respiratory causes. So anything that can lead to hyperventilation, meaning that we are now washing away way too much carbon dioxide, that hyperventilation could be due to anxiety, due to some things that would be considered normal, like pregnancy, a fever, poisoning with certain different kinds of poisons, or even living in areas of high altitudes. These can lead to hyperventilation. Again, that would cause excess wash off carbon dioxide, eventually leading to respiratory alkalosis. Well, if we are losing hydrogen ions that are non-respiratory, for example, during a gastric drainage, so let's take a scenario where a patient comes in, they know they ate something, there's food poisoning, or they were actually poisoned and you want to wash or empty their stomach contents. That's a process known as gastric drainage or gastric lavage. When you drain this gastric contents, you're obviously also draining that hydrochloric acid. So that leads to excess loss of hydrogen that can eventually lead to metabolic acidosis. Or if the patient is vomiting the gastric contents, or certain diuretics. So there are diuretics that are known as potassium wasting diuretics, meaning these diuretics increase the tubular secretion of potassium. It also increases the tubular secretion of hydrogen ions. So these patients that have high blood pressure and take diuretics for years and years can eventually develop metabolic acidosis. But on the other hand, metabolic acidosis could be due to the gain of bases. So take this different scenario where a patient comes in, they have heartburn for a very long time, and they just keep on taking in antacids. A lot of these antacids are basic based to neutralize the acidity. So the excess ingestion or administration of these antacids which are basically bases, can eventually lead to metabolic alkalosis. And here again, you could see in this image the causes of alkalosis. If it is due to a respiratory problem, that would lead to respiratory alkalosis. Anything that can lead to hyperventilation, whether it's anxiety or living on high altitudes or mountain climbing, pregnancy, fever, or the initial stages of pulmonary embolism, anything really that can lead to hyperventilation can result in respiratory alkalosis. Now, causes of metabolic alkalosis could be due to the loss of gastric contents, whether it's through gastric drainage or vomiting. It could be due to the excess intake of what are known as potassium wasting diuretics that waste hydrogen ions with it, or the excessive and overuse of antacids. And this ends chapter 21.